Hi guys, my name is Kirsten Dominic and I am currently a D&P student studying family practice at Gonzaga University. I'm going to talk to you a little bit today about adolescent obesity and the need for improved screening and interventions in the United States. In 2010, the U.S. Preventative Services Task Force recommended that clinicians start screening children ages 6 and older for obesity and then referring them to comprehensive intensive interventions to help improve weight status. In 2013, the Affordable Care Act added the Preventative Services Benefit, which started covering this screening. Medicaid and Medicare do have this benefit and cover the screening, but some private insurance companies don't. And so why is it so important that our insurance companies are paying for this screening? Currently, 17% of youth in America are obese, and that number has shown us that in the past 30 years, we have tripled the amount of obese youth in the country. Overall healthcare spending has also been affected by this. Currently, $150 billion is being spent annually on obesity-related healthcare costs. Childhood obesity is also posing a national security challenge as obesity becomes one of the biggest disqualifiers for military service, affecting 25% of those that apply to serve. Obese teenagers and children remain at a greater risk for developing serious secondary conditions as well, including type 2 diabetes, heart disease, high blood pressure, cancers, sleep apnea, asthma, and some other psychosocial effects, which can include decreased self-esteem. One study showed that 61% of overweight 5 to 10-year-olds already had at least one of these risk factors, and 26% had two or more. An overweight adolescent has a 70% chance of being overweight or obese as an adult. And by adulthood, obesity-related conditions are some of the leading causes of death in the United States. So I believe that all health insurance companies need to be covering this screening so we can prevent further complications for our patients as well as help reduce healthcare costs in the country. I also believe that our states need to get more involved. For example, Idaho has implemented the IDHCR 19, which resolves that by providing medical nutrition therapy and professional nutrition counseling for registered dietitians in conjunction with existing services covered by insurance carriers, that there will be a positive impact on BMI and chronic disease and significant healthcare cost savings in the state of Idaho. So I think if a lot of our states started implementing interventions like this, we could be offering better options to our patients as future providers. So I appreciate your time and listening, and I hope that we can all find ways as future providers to include more preventative care for our patients to help reduce all of the conditions that are coming from obesity.